Hey there, this is Luis Moreno with Simply Health Insurance Agents. Today, I got a client asking me for a quote for health insurance. And she's adamant, Luis, I want private insurance and I want a PPO. I do not want an HMO. All right, so I'm going to explain the differences between an HMO, a PPO, and an EPO. That's something that's kind of new to the health insurance world. I'm going to explain what that is and also what the options are for health insurance going forward. All right, so again, if you would do me a favor, make sure you comment, make sure you like, and please subscribe to my channel and share me, guys. All right, so what can we do? So first of all, there's some misconceptions that a PPO is better than an HMO. As far as the coverage is concerned, it's the same thing. It has to deal with networks. So when you have a PPO, in fact, I'm going to draw it out for you here. Let me get my little pad here, and I'm going to explain how this works. Maybe this will be a little easier to understand. I like drawing. Okay, so let's say that we have a PPO over here, okay? And we have an HMO over here. On the PPO, you have in-network, but you also have the ability to go outside of the network, okay? I'm trying to think of a better way to draw this, all right? So you're gonna have that ability to go outside, all right? So you're like, well, why have a network at all? Well, this is why. If you stay in the network, your out-of-pocket costs are going to be a lot less. If you want to go out of the network, they're going to charge you a heck of a lot more for medical services to receive care outside of the network. And this is because they haven't negotiated a contract and negotiated on rates with that doctor. It's just the way it is. Also, one of the good things of a PPO is that if you end up going to a specialist, you do not need referrals. So no referrals needed. Okay, so that's a PPO. Okay, you're like, well, that's great. Okay, now why have an HMO? Well, in an HMO, it's a closed network, just like this one in network. Okay. All right. But you cannot go outside the network. They limit you. They prohibit you from going outside the network only for one scenario, and that is if you have an emergency. Okay. That is the only way you can go outside the network, and you go to the ER and you go to the emergency room, and that's it. Other than that, you cannot receive care outside of the network. That's the way it is. Okay. Then we have what's called an EPO, which is a hybrid of these two. It is still a closed network, just like an HMO, but, oh, and one more thing I did forget. Okay, let's go back to the HMO. Over here, you will need referrals. Okay, so you will need referrals to see a specialist. Well, then came the EPO, and on the EPO, it is like the HMO in that you only have in-network. Okay, that's it. But when you go see specialists, no referrals needed. Okay, so it's kind of a hybrid between these two. And that's it. That's all that you've got, guys. There's no other option. You're like, well, give me something else. Obamacare, the Affordable Care Act, is the law of the land right now. And so if there's an insurance company out there that's on the individual marketplace, these are your options. In Texas, we do not have any PPOs. I don't care if you come to me and tell me money, I have so much money, I'll pay whatever. The only way you're going to get a PPO in Texas is one of two ways. Okay, let me clear this out. They're like, all right, now you're talking. You just told me it wasn't available, Luis. Yeah, I know what I was talking about. Check this out. Okay, hold on. Let me clear all this out. I wish I had a clear button. Make it a lot easier. All right, here we go. All right, let's get back over here. Okay, so if you want a PPO, okay, you can get it if your employer offers it. Okay, if you work for a company and that company has health insurance for its employees, they may or may not have a PPO. Okay, some employers offer HMOs because it's cheaper, but you can get it that way. Okay, that's one option. So you got to work for a company. If you don't work for a company that offers it, you're out of luck. You're SOL. Okay. All right. Then the other option is you can go get a short-term medical plan that subscribes to a PPO network. Okay. Now, I like using United Healthcare. I think they've got a very good short-term network, and their rates are very attractive. The problem is with short-term medical is we got two big problems. Number one, you can get this, it's designed to be a short-term. So right now you can purchase a policy for 364 days. And you can even buy what's called a tri-term, which you can buy 3 of these. But you got to get that done before September, before 9/1, because a new law just passed that says that you, starting September of this year, you can have one policy that lasts no more than 3 months. And then you can have a total in 1 year of 1 additional month. So the most that you'll get coverage for in 1 year is 4 months. They just changed the rules. The other problem with short-term medical is that it does not cover any pre-existing conditions. Okay, it does not cover them. So if you're already sick, if you've got an underlying health condition, they can deny you. With Obamacare, they cannot. Just the way it is, guys. I wish there was something better, but that's all that is out there. Okay, so we can go short term, but do not expect to get your pre-existing conditions covered. Also, they have prescription discount plans. They don't have a true discount plan. They don't cover maternity. So if you're having a baby, that's not going to help you out. And doctor copays, they have some copays, not very good, but they do have that. So again, those are your only options. I wish there was something better. Now, there's nothing wrong with an HMO. Okay, there's nothing wrong with the plans that we have right now. Now, if you just choose one based on price, but that could be a problem because all the networks are closed. This is where a good agent comes into play, because they're going to ask you for the doctors. They're going to ask you for medications. That's what we do. And then we're going to take that information and try to find you the best plan. Okay, we're going to find you a plan that covers as many of those doctors that you have and also as many of those medications that you have. That's what we're going to do. And if for some reason, maybe you have 4 docs and what's not covered, we're going to let you know. We're just not going to surprise you when you go see them. We'll let you know, hey, I'm sorry, I can't get all 4. Nobody will get all 4. I've got one plan that will cover 3. I've got another plan that will only cover 2. And I've got another plan that doesn't cover any of them. I mean, who knows what the scenario can be, but we're going to let you know so that you don't have any surprises. Or maybe we can cover all 4 of them, but we have to put them with this plan over here. And this plan is super expensive. So what do you want to do? All right. So that's what a good agent does. So I hope that helps you out. Guys, do me a favor, make a comment on this video. Okay. I answer all the questions and I respond to all your comments. Like this video. And if you would, subscribe to my channel. I appreciate it. Thank you.